Coronary artery disease is one of the leading causes of heart-related symptoms like chest pain, also known as angina. For many patients, undergoing a percutaneous coronary intervention, PCI, with stent placement is expected to bring immediate relief. But what if simply seeing the success of the procedure could make a difference in how patients feel afterward? A recent randomized clinical trial, the PLA-PCI EBO pilot study, explored whether showing patients before and after images of their artery blockages could enhance their recovery and improve their quality of life. The study was conducted across 5 hospitals in Germany, involving 145 patients with stable coronary artery disease. All patients received PCI with drug-eluting stents. However, they were split into 2 groups. The control group received a written procedural report, which is the standard practice in hospitals. The image group, on the other hand, received printouts of their angiograms before and after PCI, along with a doctor's explanation to emphasize how the procedure had improved their blood flow. Researchers followed up with these patients for 6 months using the Seattle Angina Questionnaire, a validated tool that measures chest pain severity, physical limitations, and quality of life. Did seeing the images improve recovery? Interestingly, the study found no significant difference in overall quality of life between the 2 groups after 6 months. Both the control group and the image group experienced improved symptoms, but the additional visualization of their revascularization did not lead to dramatically better outcomes. However, the image group showed slightly higher treatment satisfaction, particularly at the 6-month follow-up. Several factors could explain these results. First, PCI is already a highly effective treatment for stable coronary artery disease, meaning most patients will feel better regardless of whether they see their angiogram images. Second, the study only used unmodified angiogram images, which can be difficult for non-medical individuals to understand. A more personalized or simplified visual explanation might have had a stronger impact. A patient's experience, the role of perception in recovery. Imagine a patient named Michael, who has been struggling with chronic chest pain for years. He undergoes PCI, and afterward, his doctor shows him detailed images of his previously blocked arteries, alongside the newly opened stents. Seeing this makes him feel reassured. The problem is fixed. But in the weeks that follow, Michael still experiences occasional discomfort, which is normal as the body heals. If he was expecting an instant and complete cure, this could lead to frustration. On the other hand, another patient, James, who did not receive the images, might simply focus on how he feels day to day and notice gradual improvement without questioning the procedure's success. This highlights an important takeaway from the study. While visualization can be a valuable communication tool, it does not replace long-term symptom management and patient education. What this means for patients and doctors. The PLA-PCI EBO trial suggests that showing patients their before and after images of PCI may not have a major impact on their symptom relief, but it could improve their understanding and satisfaction with the procedure. Moving forward, research should explore whether more interactive or simplified visual explanations, such as animated models or personalized discussions, could enhance long-term recovery outcomes. For patients undergoing PCI, the key takeaway is this. While it's helpful to see the success of the procedure, true recovery depends on lifestyle changes, adherence to treatment, and ongoing cardiovascular care. If you or a loved one has had a PCI, focusing on long-term heart health is just as important as the immediate results.